The Chinese Center for Disease Control and Prevention, or CDC, announced on July 6th that there were 1,968 new COVID-19 cases and 239 deaths in the country during June. This data indicates a significant rise in the death toll from the epidemic, occurring a few months after officially canceling the zero-COVID policy. The revelation has once again led the international community to question the transparency of the Chinese government regarding the true extent of the epidemic within the country. According to VOA, China implemented the zero-COVID anti-epidemic policy at the start of 2020, employing 4 principal measures to control the disease's spread. These measures included citywide lockdowns, mass quarantines, travel restrictions, and mandatory nucleic acid testing for all residents. In the early stages, these practices proved effective in containing the virus. However, as the pandemic progressed, the COVID-19 virus mutated, rendering the extreme prevention and control measures less effective. Furthermore, these measures resulted in significant hardships and psychological trauma for the residents, leading to numerous humanitarian crises. Consequently, China's unrivaled economy suffered an unprecedented blow, since the reform and opening up policy was implemented over 4 decades ago. The consequences of this economic setback have yet to be fully recognized. Without any prior preparation, the Beijing government abruptly lifted the epidemic prevention and control measures under the flexible zero-COVID policy at the end of last year, resulting in 10 deaths in less than 2 months. The impact of the virus has been substantial, with over 1 billion Chinese citizens reportedly infected, and a noticeable increase in the death toll. However, due to stringent conditions set by Chinese authorities for counting deaths, the official figures have significantly underrepresented the extent of the epidemic within the country. Globally, the World Health Organization, or WHO, has reported over 761 million confirmed cases and more than 6.8 million deaths as of March 26, 2023. Notably, this data does not include information from China. Earlier this year, RFI quoted WHO Secretary General Tedros Ghebreyesus, stating that by mid-January this year, deaths worldwide had reached nearly 40,000, with more than half of those deaths occurring in China. The actual death toll within the country is believed to be significantly higher. Chinese officials resumed releasing data on COVID-19 deaths only in May and June this year. On July 6th, the Chinese CDC reported 1,968 new severe cases and 239 deaths in June. The announcement also disclosed that China had reported 12,431 valid genome sequences of new local cases of COVID-19 infection in June. All of these cases were found to be the Omicron variant, with 141 belonging to the XBB lineage variant strains. The top 3 strains were XBB.1.9, XBB.1.16, and XBB.1.22, respectively. When analyzed by sampling data, the share of XBB and its sub-branches gradually increased, from 94.7% between May 29th and June 4th, 2023, to 96.2% between June 26th and July 2nd,